Hi, good evening everyone. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Today I've chosen a very interesting topic, not so heavy, but very relevant, and it's mainly for awareness for all the women out there. Very often I see women who come to me with certain complaints, and then I will ask them, do you think you could be pregnant? And then they will say, no. Why? They have that funny look in their face. It's like they had their menses, how could they be pregnant? So some of them will even tell me, I just had my period. And I'm like, period also can be pregnant one ma. So you see, a lot of people think that as long as they have their period, then they are definitely not pregnant. So that is not actually true. And if you actually browse through Google, you will see cases of things like that. Women didn't know that she's pregnant, she got period every month, and then suddenly she had tummy pain, and then she went into labor, and then she gave birth. Oh, 9 months of pregnancy, and she got no idea because she had period every month. And such things do happen. A lot of people do not know that they are pregnant because they have their periods, so they don't know. Why is that happening? There are a few aspects that we need to talk about today. There are many different scenarios, and which I'm going to talk about today in this topic. Because I realize everybody, because what we learn in science, we learn from school, we learn from basic science that when you get pregnant, your period don't come. When you get pregnant, your period don't come. So your period come, must be you're not pregnant, right? So then you thought you're okay, you're not pregnant, but actually you could be pregnant until you don't know. So this is something that many women do not know. So that is why I've decided to have this talk, and I want to share with you many different situations whereby you could be having menses and you could be pregnant too at the same time. Okay, so let's start. Okay, so this topic is partly created. I thought of it because of few instances recently whereby I have women who come and see me, and then when I ask them, do you think you're pregnant? Then they will still always answer me, I just had my period, what? Okay, so the fact that I ask you means there is still possibility that you're pregnant even though you had your period, okay? So let's start. What are the situations? The situations are, number one, we know about implantation bleed. Implantation bleed is a situation where you actually bleed at the time that you're supposed to have your menses. So you have that little bit of bleeding at the time when you're supposed to have your menses, and actually it's implantation bleed. Implantation bleed means you're pregnant, no? So you can have bleeding and you do not know that you are actually pregnant. But most of the time in these type of cases, their menses may not be very heavy, may be very little. But there are people who often have very little, very low flow for their period, so they cannot tell the difference whether this is implantation bleed or this is menses. So this is what that can happen. But most of the time we say implantation bleed is very little one. It's when you're supposed to have your menses, but your menses didn't come, but you bled a bit, and then after that it stopped. So this could be also due to pregnancy. So when you have this little menses that is very little when you have your menses, the first thing you need to think about is you want to do a pregnancy test to see if you're pregnant. Then there is also another situation whereby you will actually have bleeding, but actually it's not implantation bleed. You must understand that some of us may have some polyp, may have some fibroids, may have some adenomyosis, adenomyoma, and these type of situations, you also have a tendency to bleed during menses. To bleed during pregnancy. So when you bleed during pregnancy, you can bleed on the dot when your period is supposed to come, or it may be a bit delayed. So let's say if you bleed a bit later, some of you may also think that you are not pregnant, but actually you can be pregnant. And depending on how bad your polyp or your fibroid or adenomyosis, some of you may actually bleed quite a lot, not just like implantation bleed. Implantation bleed usually like little bit, 1 day, 2 days, and that's it. But when you bleed from fibroids or polyps or adenomyosis, you can actually bleed like the whole 5 days, 6 days, 7 days, and you may actually think you're having menses, but you are not having menses. You can be pregnant, okay? You can be pregnant. And then There is also another situation we call, especially nowadays, a lot of people do IVF. So for IVF, they like to take the blood test to check whether you're pregnant or not. So when you take your blood to do pregnancy test, it can detect at very, very early stages. But yet, you check, oh, my blood test show I'm pregnant. But after a few days, my menses come already. These are things is actually could still be biochemical pregnancy. Actually, biochemical pregnancy is actually very, very common. It's actually very, very common. But most of us do not realize it because when menses come, we won't bother to go and do a pregnancy test. But it's only the people who are doing IVF, they will actually purposely go and do the blood test to see if they're pregnant. Because blood tests to check whether you're pregnant can be done even before your date of your menses. Let's say your menses will come today. A few days ago, you can already know whether you're pregnant but just by doing blood tests. And if you get a blood test and then your menses come and then you repeat your blood test and you are no longer pregnant after your menses, then this is a biochemical pregnancy. Then there is also another situation we say abnormal pregnancy. Abnormal pregnancy means you can be having a miscarriage or a threatened miscarriage or an ectopic pregnancy. So when you have miscarriage or ectopic pregnancy, you can bleed also. So when you have all this bleeding, then you may think that I'm not pregnant, but actually you can still be pregnant. Because recently I had one lady who came to see me. Actually, she's a alternative medicine medical doctor. So in a way, she is practicing alternative medicine. So she had abnormal bleeding and I told her, could you be pregnant? And then she's like, I have menses, so how could I be pregnant? Then I was like, are you supposed to be, some form of health practitioner? You should know this thing because she's actually, although she's not a medical doctor, but she's still seeing patients because she is a alternative medicine practitioner. So she's still seeing patients. So by right, she should know that even having menses, that she needs to know that she could still be pregnant. So these are some of the situations, and some more is, just now I was telling you about cases when you Google, you do hear people who have menses every month and then suddenly they go 9 months, they have tummy pain, they have labor and they give birth. And all 9 months they have menses. How come they have menses all 9 months? And so they do not know that they are actually pregnant. Why? Because if let's say you are taking some contraceptive pill, if you're taking contraceptive pill, or maybe you are having an IUD inside you, you must understand when you have IUD and when you're pregnant, they still bleed one. And then if you take oral contraceptive pill, sometimes when you're pregnant, you still continue to bleed. You will have this bleeding that will come because pregnant still taking pill is not normal. So this abnormal situation can also cause bleeding. And more common that I see is those people who take emergency contraception, or simple, they call it morning after pill. Morning after pill is the pill that you take after you have sex. It's like emergency. That's why we call emergency contraception. That means you have sex and then you never take precaution and then you panic and then you fast go and take emergency pill, or we call it morning after pill. And this type of pill, they actually tend to cause a lot of funny bleeding. And if you continue to take every now and then you have sex, because I know women who take emergency contraceptive pill for long-term one. Every time they have sex, they take it. Every time they have sex, they take it. That's why this type of women, I always tell them, don't take morning after pill long-term. You're supposed to take as real emergency that you take once and then that's it. And then you must think about what you're going to do next as a permanent long-term contraception. So if they take emergency contraception, I always tell them, you'll be pregnant until you don't know. Because they still bleed, and they bleed, and they bleed. So when you bleed every month, you may think that you're not pregnant. And especially for women who menses not necessarily every month, same time, Sometimes a bit late, sometimes a bit early, sometimes a bit late, sometimes a bit early. So if you have IUD or you have a contraceptive pill or you take emergency contraception, you can also have bleeding. Sometimes early, sometimes late, sometimes early, sometimes late. Then you don't even realize you're pregnant until maybe 9 months. Because when you don't know you're pregnant, sometimes women now, when they don't know they're pregnant, baby kick also, they don't realize baby kick. They don't realize anything one. They just go on as though everything is okay. Their tummy get bigger, they think they're fat, and they go on diet. So things like that, you can actually drag on for all 9 months and then suddenly, oops, give birth already 9 months, and then they have period for all 9 months, but they're actually pregnant. Okay, so these are the situations that can cause bleeding. So you can be pregnant, but you can also be bleeding. So you can be pregnant and you're bleeding. In one situation, I say biochemical pregnancy, but actually you lost your pregnancy already. So this thing is actually very, very common, but so common that we don't know. Nowadays, we know more. It's because we tend to do blood tests before your period in cases that they do IVF. That's why we start to see a lot more biochemical pregnancy. So it can be due to pregnancy, but bleeding due to abnormal reason. Abnormal reason means like miscarriage. It can be threatened miscarriage, missed miscarriage, or it can be due to ectopic pregnancy, which is again abnormal pregnancy. Or it can be due to normal pregnancy, but you have something in your uterus. Maybe you got polyp, you have fibroid, you have adenomyosis, you have infection. These type of people will keep on bleeding one. So they keep on bleeding until they don't know whether they are pregnant or not pregnant. And last of all, it could be due to certain contraception that you have been taking. It can be oral contraception, IUD, or even emergency contraception. So all these situations can cause you to have continuous bleeding over the months until you don't even know that you're pregnant until 9 months later. Okay, so this is a very short topic just for awareness, but I realize there's some questions. So if you have any questions, just put in the comment section now. And also, as I always mention, I need also more suggestions from you on what I can do in my next future live videos, because I need more feedback. I've just had so many videos by now. I think I have almost like 30 videos by now, so also running out topics. So I need more suggestion what you want me to talk about, okay? For those of you who are new and may have missed some of my old live videos, please go to my YouTube channel, yeah? Dr. Tan CT Clinic. Go to my YouTube channel and watch all the videos that you have missed, okay? Alright, let's go through some of the questions that have been coming in. Okay, so any things you want to talk about, please just write it in my comment section, okay? Norlin said she has a topic that is out of topic but need opinion. My pregnancy test showed positive, but when I went to clinic for scanning, the doctor cannot see my baby inside my tummy. Is there any case same as mine? Is it mengandung luar rahim ke? Mengandung luar rahim is ectopic pregnancy. Okay, there are few reasons why you are pregnant and yet when you go and do an ultrasound scan, you cannot see anything. Okay, number one, it could be still too early. Because urine pregnancy test, we say minimum is 4 weeks. But to see a pregnancy in an ultrasound, to be on the safe side lah, because there are good machine, lousy machine, clear machine, not so clear machine. Also depends on you that day whether your tummy is gassy or not gassy, whether your bladder is full, not full, whether your doctor do internal scan, don't do internal scan. So to be on the safe side, we say 6 weeks lah. So pregnancy test positive, you need at least 2 weeks later to be very safe. I should be able to see my pregnancy. 2 weeks after your pregnancy test, or to be safer, 3 weeks. 2 weeks sometimes also can still miss one in certain cases. So if 3 weeks after your pregnancy test, you still cannot see, then it's not normal. But if it's still within the 3 weeks, it can still be too early. Okay, can still be too early. It could be due to machine factor, new machine, old machine, clear machine, not clear machine, or whether your doctor did internal scan or not, or just scan from the tummy, and also your situation on that day, whether your bladder is full, not full, or whether your tummy a lot of gas, not a lot of gas, because in very, very early pregnancy, it's so tiny, it's so tiny. So sometimes if a lot of gas, not enough urine in your bladder, or a bit older machine, never do internal scan, sometimes cannot see lah, so it can be still normal, yeah? But of course, if it's more than 2 or 3 weeks after your pregnancy test, then we always say that it is not normal. Then the chances of ectopic pregnancy could be there. But to confirm, usually we have to do blood tests, because only blood tests can tell me exactly how many weeks pregnant are you. So urine test sometimes also, we need minimum 4 weeks but maybe you did the urine test at 5 weeks or 6 weeks, so we won't know exactly how many weeks pregnant by a urine test. Count from Menses, lagi not accurate, so that one cannot use one. So blood test is the most accurate to know exactly how many weeks pregnant you are, okay? It may be mengandung rahim, it may be, but not necessary. Very often, it is still too early. To be sure, then you need to do a blood test, or you just do another scan in a closer period, maybe after 1 week or 2 weeks, like that, okay? Bintu Abu Bakar asks, I'm having brownish discharge for a few days already. Since 7th of this month, I'm 5 weeks pregnant now. Is it normal? So you have this brownish discharge, means you have some amount of bleeding. So you're having bleeding during pregnancy, and you are now 5 weeks pregnant. So 5 weeks is about the time where we say implantation bleeding is supposed to happen. But for implantation bleeding to happen for so many days, it's a bit abnormal. So in this sort of situation, I wouldn't think about miscarriage so much yet, because miscarriage usually, I would think if it's later lah. In 5 weeks pregnancy, you can still bleed due to many other reasons. So why you bleed during pregnancy? There are also many reasons why a person bleed during pregnancy one. So yeah, it is actually a good topic to talk about. Maybe I'll do it the next time, okay? So what you need to do, Bintu, it can be normal, it can be not normal. It can be normal, it can be not normal. Not normal also, it can be due to pregnancy problem. It can also be not due to pregnancy problem. Like I mentioned earlier, maybe you got fibroid, maybe you got polyp, maybe you got a cervical infection. So actually you don't know, you have to go and check. So you have to go and check. So you need to go and see a gynae, get ultrasound scan first. If ultrasound scan is normal, then the doctor will probably need to assess a lot of other things. So it can be due to pregnancy problems like miscarriage, ectopic. It can be due to problems with your uterus. Okay, so it can also be due to nothing, totally something that can happen in all pregnancies. Okay, which I will talk about in another topic, because this is actually a very interesting topic to talk. Can talk a long time, quite a long time. A lot of things to talk about. So, Sujin asks, okay, so someone, Sujin asks, why women get polyp? Okay, if you want to really know in very detail, do I have a topic on polyps? Oh yes, I do have a topic on polyp. If you want to really know in detail, you can go to my YouTube channel, yeah, Dr. Tan City Clinic, and browse through the whole YouTube channel to look for polyp or search for the word polyp. And I have actually talked about polyps in one of my YouTube channel previously, okay? So there are many reasons also why people get polyp. So yeah, you can go and look at it, okay? But in general, I always say women like to grow things. It's not polyp, then it's fibroid. It's not fibroid, then it's cyst. Okay, women just like to grow things, okay? And the reason why women like to grow things, I also mentioned in one of my videos, which is, I always say, women don't give birth, must grow something. You don't want to give birth, you must grow something. So you either grow a poly, or you grow a fibroid, or you have endometriosis, or you have adenomyosis, or you have breast lump, or you have cyst, you have something one lah. So you need to give birth, okay, non-stop. So I mentioned it in my contraceptive video because it is a very simple principle I mentioned so many times. Women don't want to give birth. If you don't give birth long enough, your body tends to grow something, because your body is meant to get pregnant and give birth. So if you don't want to give birth and you don't want to grow something on your uterus, then you need to be on some form of contraception. You need to tell your body, I don't want to be pregnant. So if you do not take anything, then you have chance of getting pregnant. That is in general. But of course for polyp, you have a special reason on its own. You can always go to my YouTube channel and look up for polyp and find out more. Hi Fatin! Some of you are just very regular followers. Thank you very much for staying tuned every Sunday 9 PM, okay? Okay, Fia Maro say, Doctor, is it normal period 2 to 3 days only every month, medium flow? Yes, it's normal. Everyone is different. Some people got heavier flow, some people light flow. You have 2 days, 3 days, you have different things. And everyone is different. But of course, if there's changes, sometimes there are changes. Previously it's like this, now it's like this, then usually there is a reason for it lah. But if you've all along had period 2 to 3 days every month, that is you lor. There's no issue about that at all. You're most welcome, Sujin and Fia. Trini has quite a long question here. I've been having bloody discharge for 1 month. Found out it's polyp. Just had it removed last week. So far no more bleeding after it is removed. But I had some sticky brownish discharge after that. I wonder why it's that. Okay, when you take out polyps, you will expect some amount of bleeding for a few days lah. Normally we say 2-3 days lor, because there's a wound ma. You take out polyp, there's a wound ma. The wound have to bleed, right? But if your bleeding become a bit longer, then it is also not quite normal lah. You need to find out, maybe your wound is infected, maybe you need to take antibiotic, or maybe the polyp is not fully removed. It's actually quite common for polyp to be not fully removed, because polyp, the root is actually very, very deep-seated one sometimes. So when we look at this superficially and we take out and then we leave the root behind, then sometimes can still bleed lah. So yeah, you just need to get checked lor. Go and see doctor and get yourself checked, okay? Next question comes from Siu Hui Tan. Siu Hui Tan asks, period monthly doesn't mean ovulate monthly. Is that right? Oh yes, it's not. You are very, very right. Because all along when we study in school, we always study ovulation, menses, ovulation, menses. I also learned that, for secondary school all the way until my Form 6, A-level. That's what we learn, okay? But when I went to medical school, then we learn there is ovulatory cycle and non-ovulatory cycle. Then only I know you have cycle that you ovulate and cycle that you don't ovulate. So you don't ovulate, also you got a cycle. So you got a cycle, you also got menses. Okay, so that's why a lot of women, they always got this misconception, because they always think that as long as my menses come every month, I must be ovulating every month, so I should be able to get pregnant. But then they're not getting pregnant. Then my question, I will always ask them, do you know whether you're ovulating every month? Then they will answer, I have my menses every month ma. Then I'm like, no, okay, no. You still need to have certain evidence that you are ovulating every month. So for all fertility cases, evidence of ovulation is actually very important. You really have to look for it. Bintu asks, just now I think continue your question. Did an ultrasound on the 7th. He didn't mention anything about growth or abnormalities. In this case, are there any other possibilities that he will go do a scope into my vagina? His first time being pregnant, so I'm quite worried. Yes, Bintu, we need to look into your vagina. So if you have an ultrasound at your tummy, then you are not seeing everything. Because one of the common reasons for bleeding during pregnancy is polyp. And polyp must go inside the vagina and check. So you won't know whether your uterus is really good or not unless you will have a vagina check. Why you worry? Nothing one lah, actually. Sometimes think about it, it is also good that your doctor check your vagina, because you know, right, when you give birth, that is what we need to check again and again and again, so many times in one day. Have some introduction, do a simple check onto your vagina and look at your pelvic. Take it as a practice practice before the actual birth. Shanice asks, can stress cause abnormal period? Of course, stress can cause an abnormal period lah. I had first time early period last 2 months. I never had early period. I tell you, Shanice, MCO start, so many people having abnormal period. You know, I see patients every day. One is the first period, the first time is during the early phase, April, May. A lot of people have period abnormal. Why they so scared? They're scared of the virus. They're so scared of the virus. And now, it's not because they're scared of virus, because life is so stressful. Either they worry about retrenchment, they worry they're financially short because pay cut, retrenchment, a lot of problem, work from home, they don't like it, they find very stressful working from home. There are a lot of reasons why people are stressed during this whole pandemic, honestly. I also stress lah. I also stress. I stress because I cannot go holiday, so sad. And because I cannot go holiday, I have to work every day. Because if I don't work every day, I sit at home, I don't know what to do. I'm so stressed too. Everybody is stressed. Okay? People got work also stressed, no work also stressed. Sad. So yes, okay, so during this pandemic, I really see a lot of women who have abnormal menses. Almost every day I see women like that. Almost every day, okay? Alright, welcome, most welcome Trini. Amy has a question. Yeah, Amy. Dr. Tan, in my previous polyp found through hysteroscope, I went to find 5 gynae but didn't see the polyp from ultrasound. How should I prevent polyp or monitor growth of polyp in the future? Okay, Amy, if the polyp is not disturbing you, let's not disturb the polyp. Because honestly, even if you have polyp, not necessary we need to do anything. We only need to do something if the polyp is disturbing you. So let's say you have abnormal menses, then you want to check whether you have polyp or not. If the polyp is not disturbing you, you don't have to go and disturb the polyp, you know. So, but of course, you must understand, hysteroscopy is definitely the only way that is 100% accurate to look for polyp. Ultrasound very much depends, no, as I just now mentioned, good ultrasound, bad ultrasound, whether you ultrasound from the tummy, whether you ultrasound from the vagina, whether your bladder is full, not full, whether your tummy got a lot of gas, don't have gas, all this can affect whether you can see the polyp or not. But of course, there is a method of doing ultrasound that is very much more effective and accurate to look for polyp, which we call saline ultrasonography. Saline sonography, which means that saline is water, a kind of water, is salt water. So we put salt water inside your uterus, then only do the ultrasound. So basically we put a tiny little plastic tube into your uterus, not all the way in, just at the outlet enough, and then we flush water in. So basically we flush water into the uterus so that you actually can see water inside your uterus. So let's see if I have some of the pictures that I have last week. So last week I talked about ismosil. So I had this, when you scan into the uterus, this is the normal uterus, right? So sometimes we may be able to find it a bit difficult to look for very small polyp. Is sometimes very difficult to look at it. So what happens is that if you can put water inside your uterus, yeah, I got this nice picture. If you can put water inside your uterus, then the middle part of the uterus will be black. So if you have any polyp, it'll be easier to see. Like this picture, see, once they put water inside, then you can see the polyp easily. So that is one way, okay? So how to prevent a polyp in the future? Amy, if you want to know more about polyps, please go to my video on polyp. But in general, most of the contraceptive pills or injection or implant or Mirena all can prevent polyps. So if you're on long-term all this type of medication, you can prevent polyp. Like I mentioned just now, women don't give birth too long, must grow something. You don't want to grow those things, you must be on contraception to tell your body that you do not want to be pregnant, okay? Let's see other question. Wing Yan asks, yes, Wing Yan also saying, Doctor, me too, abnormal period during MCO, but now, thank God, slowly getting back normal, hopefully. Yes, thank God. I hope that your period will be normal after this completely. Amy mentioned that few spots of polyps were found through the procedure. Why can't see from ultrasound? Is it normal? So I mentioned just now already, yeah? Okay, yes, Amy, you can always come to KL, Amy. But if you can't come to KL to see me also, you can always book an online consultation, okay, Amy? But of course, the online consultation, I cannot do ultrasound for you. Okay, Amy Mashita said, my sister had fibroid 3 cm, 2 cm. During sex, she had bleeding, necessary for remove. if bleeding during sex, then need to remove lor. Don't live with abnormal things and consider that as normal. Why? Because when you have bleeding during sex, we all worry about one thing, cancer. When you talk about after sex bleeding, you only worry about one thing, cancer. Then let's say your bleeding after sex is due to your fibroid. You don't want to live with this fibroid forever and live with the bleeding after sex forever and always thinking that you are normal. Maybe one day it's cancer, how? Right? So that's why I always tell a lot of women, don't live with abnormal things forever and treat it as normal. And then one day when it becomes cancer, how? You don't even know, I don't even know. All of us been thinking that you are living with that for all these years and it's normal. Okay, so don't. Okay, Trini asked, I think I mistaken polyps for something else. I forgot what mine is called. My body told me there's an extra growth from the uterus wall thickening. Until the extra growth that is causing my, is slightly, yeah, Trini, that is a polyp. That is a polyp. But the fact that it's growing from the uterus wall thickening means the polyp is very deep inside. So sometimes it depends on how it's taken out, because I don't know what you went through. Trini, how do you remove your polyp? So depending on how you remove, so some procedures that are done to remove polyp actually doesn't remove the entire polyp, and they actually leave behind the root, because the ways to remove the polyp all the way from the root is not a procedure that is commonly done. So there are many people who actually get a polyp removed that is not totally complete one. Yeah, Amy asked if remove the fibroid, if don't remove, will she conceive when it will come back? You see, if you every time have sex bleed, how to get pregnant? How to get pregnant? Why? Because blood got a lot of cells that we call like Pac-Man. They like to eat up all the sperm. So when you have sex and you bleed, then all these cells will be there to eat up all the sperm. How to get pregnant? So when you have bleeding after sex, you want to get pregnant, you need to solve the bleeding. Okay? Well, and if you have bleeding after sex and then suddenly you get pregnant, then during pregnancy you're definitely going to bleed also lah. Okay, so my advice for all women out there is, if you have something abnormal that happens to you every day, don't keep it. Don't make abnormal become normal, okay? Don't live with abnormality. Always make sure you're back to normal. We want to get back normal. So polyps that don't disturb you, don't disturb the polyp. Fibroid don't disturb you, don't disturb the fibroid. But if the fibroid is disturbing you, then you need to disturb the fibroid. You need to get back to normal. We need to be normal and be as normal as possible. Okay? So Wing Tan, you're most welcome. I'm very, very happy that I can share knowledge to everyone here today. And I want to thank all of you for staying tuned to my every Sunday 9 p.m. video. So now, any more topics that you want me to talk about, anything that you're interested, please put it up in this comment section, and then so that I have new topics to talk. So I need inspiration from you all as well, okay? So do put a note in the comment section. Okay, so that's all for tonight. Okay, thank you and bye-bye.